A dental hygienist is a licensed healthcare professional who supports the health and well-being of the public through oral health promotion, education, prevention, and therapeutic services. A visit with your dental hygienist is composed of various phases known as the dental hygiene process of care. The purpose of the dental hygiene process of care is to provide a framework where the individualized needs of the patient can be met, and it is used to identify the causes or factors of a patient's condition that can be reduced, eliminated, or prevented by the dental hygienist. The dental hygiene process of care is comprised of 6 components: assessment, diagnosis, planning, implementation, evaluation, and documentation. Each phase is a key component of the overall treatment that focuses on providing patient-centered, comprehensive care and forms the foundation of clinical decision-making. Planning and providing optimal care require a thorough and systematic overall observation and clinical assessment. Step 1 in the process of care is patient assessment. Assessment of the patient begins with a review of their health history. The client should sign the written health history form at each appointment to confirm its accuracy. The patient's vital signs, including temperature, pulse, respiration, and blood pressure, are taken to provide a baseline and help identify potential or undiagnosed medical conditions. A current, complete, and diagnostic set of radiographs provides needed data for a comprehensive dental and periodontal assessment. Another component of the clinical assessment includes an examination of the head and neck and oral cavity, including an oral cancer screening, documentation of normal and abnormal findings, and assessment of the temporomandibular joint function. In order to assess periodontal condition, the dental hygienist performs a comprehensive periodontal examination that includes full mouth periodontal charting. The measurements are taken with a periodontal probe. Some of the measurements that are assessed include probing depths, bleeding points, recession, attachment level, attachment loss, presence, degree, and distribution of plaque and calculus, mobility, gingival health or disease, bone height or bone loss. The data are input, and they provide the clinician with the information to develop and design strategies for preventing or limiting disease and promoting health. Once all the elements of the assessment phase have been gathered, the dental hygienist has the information to move on to the next phase of treatment, which is the dental hygiene diagnosis. In this phase, in discussion with the client, their needs and priorities are documented and goals are set to meet these needs. The dental hygiene diagnosis provides the basis for the dental hygiene care plan and is a key component of the process. It involves assessment of the data collected, consultation with the dentist and other healthcare providers, and informed decision-making. The next step is treatment planning. Planning is the establishment of goals and outcomes based on patient needs, expectations, values, and current scientific evidence. The dental hygiene care plan is based on assessment findings and the dental hygiene diagnosis. The dental hygiene treatment plan is integrated into the overall dental treatment plan. Stage 4 is implementation. The implementation phase is the phase where the care plan is brought to life. Implementation of dental hygiene services begins with home care instructions. Dental hygienists are educators as well as dental care providers. Patient education is an integral portion of the dental treatment as a whole. Dental hygiene services are delivered based on the dental hygiene care plan in a manner minimizing risk in optimizing oral health. In the eyes of many clients, it is this phase of treatment that is the most relevant during the visit with the dental hygienist, since they leave with a cleaner feeling mouth. The fifth phase of the process of care is evaluation. Evaluation is the process of reviewing and documenting the outcomes of dental hygiene care and occurs throughout the process. It is required that previously established goals are evaluated and modified if necessary. Or, if the goals of an appointment are not met, modifications to the care plan are made, highlighting the new client goals. The sixth phase is documentation. Complete and accurate recording of all collected data, treatment planned and provided, recommendations, and other information relevant to patient care and treatment is continuously documented and reviewed. Documentation includes consent to treat and is signed by the patient. The dental hygiene process of care is a cycle in which the dental hygienist might pass through each of these steps several times during the course of treatment. Over a period of months or years, a dental hygienist may have evaluated his or her work several times, altering the diagnosis and plan numerous times as the patient's condition changes.
Are you married?
So I am. Somebody apparently doesn't remember if I'm married.
Lucky guy.
What an idiot.
So how
Do you have
long
any
is it?
kids? Mine are brats.
I'm not filming.
I find you to be kind of an intimidating guy. You need to back up. Oh really? What do you think you are?
Clean cut.